Hello, welcome everybody to the sorry, I am having here one problem. Okay. Welcome everybody to the 7th session of iCEBreak. Today we welcome Eugénia Nogueira, researcher at the Bioprocess and Bionanotechnology Research Group at the Center of Biological Engineering of the University of Minho, to talk about liposomes encapsulating methotrexate to fight rheumatoid arthritis. Eugénia, I thank you very much for your presence and contribution to deepen your knowledge in such, our knowledge in such an interesting team. And now, Eugénia, the screen is yours.
Okay, can you hear me now? Yes, thank you. Good morning. First of all, I would like to congratulate the organization of iCEBreak for the initiative, and of course, to take the opportunity to present you my work on liposomes encapsulating methotrexate as a powerful tool for rheumatoid arthritis therapy. Every day, millions of people around the world suffer of swelling and pain of their joints due to rheumatoid arthritis. Indeed, rheumatoid arthritis is the most common inflammatory rheumatic disease. This autoimmune disease is characterized by inflammation of joints, resulting in synovial hyperplasia, by infiltration of activated immune cells, further leading to cartilage and bone destruction. Although the cause of rheumatoid arthritis is unknown, many pathways involved in generation of the disease have been recognized. The complex interaction of cytokines and effector cells is responsible for the joint damage that begins at synovial membrane and affect other structures. Okay. As many other diseases, rheumatoid arthritis is a combination of genetic and environmental factors that, when present, increase the susceptibility to develop clinical manifestations. Multiple loci contribute to the genetic risk for rheumatoid arthritis, behind the human leukocyte antigen locus, the most important. However, this higher risk of rheumatoid arthritis is just present in patients with rheumatoid factor, an antibody directed to the Fc region of hemoglobin G, and especially patients with positive anti-citrullinated protein antibodies, the ACPA. The anti-citrulinated protein antibodies can recognize the non-classic amino acid citrulline present on a protein sequence. Citrulline is produced by a post-translational modification of arginine mediated by an enzymatic process. This reaction happens during a variety of biological processes, including inflammation. Several studies report the central importance of macrophages in pathogenesis of rheumatoid arthritis. They produce cytokines, which in turn promote inflammation by recruitment of additional immune cells. If left untreated, such inflammation can progress to joint destruction, especially in the hands and feet. Methotrexate is the first-line therapy in patients with rheumatoid arthritis. However, several side effects are associated, and when patients do not respond or become intolerant, biological therapies should be used. The problem is that biological therapies are 20 to 200 times more expensive. So it's important at least increase tolerance to this drug, methotrexate, and delay the introduction of biological therapies into the treatment. In this presentation, I will exploit the potential of liposomes as an effective system for deliver methotrexate in target key effector cells and reduce long-term effects of rheumatoid arthritis. Liposomes are a type of nanoparticles consisting in the lipid bilayer. Behind the unique characteristics of liposomes of being both non-toxic and biodegradable and protect the drug of degradation, our liposomal formulation showed to be stealth due to the presence of polyethylene glycol. Modification of liposome surface with polyethylene glycol clearly showed to extend the circulation lifetime of the vehicle. It was known that activated macrophages are key effector cells in the development of rheumatoid arthritis. So their selective neutralization is an appealing approach to rheumatoid arthritis therapy. Activated macrophages have been shown to specifically express a receptor for the vitamin folic acid, the folate receptor. There are several isoforms of this receptor, expressed in general only in cancer cells, alpha isoform, and activated macrophages, beta isoform, not being expressed in the other normal cells, including the other macrophages. We developed a new liposomal formulation, encapsulating methotrexate with a hydrophobic fragment of surfactant protein D to folic acid folate to target the activated macrophages expressing the folate receptor. To prove the ability of our liposomal formulation as a drug delivery system, liposomes encapsulating methotrexate were administered in arthritic mice before disease onset. A complete prophylactic efficacy was observed in mice treated with folate-targeted liposomes encapsulating methotrexate, where mice did not show any clinical signs of arthritis. Comparatively, when the drug is injected in a soluble form, it only had a marginal effect and did not prevent the development of arthritis. Furthermore, our data demonstrates that, in contrast with the free form of methotrexate, encapsulated methotrexates are selectively retained in plasma and are not subjected to immediate absorption and filtering by the main organs. This signifies that liposomes can circulate to their peripheral target tissue and be bound there instead of being non-selectively absorbed by the intestine, liver, or kidneys. This suggests that the therapeutic agent would be present on its target cells in stable amounts sufficient to exert an effect, decreasing the possibility of secondary effects. This fact is particularly important in rheumatoid arthritis because methotrexate presents several side effects such as toxicity and depression of the bone marrow or injury of the liver function that might lead to hepatitis. These results were obtained during my PhD under a non-of-all European project and paved the way for further clinical designs, which encourage us to develop the new European project, Folate-targeted. This new project aimed at the good manufacturing practice, production, and in vivo validation of the new liposomal formulation, as well as further application on the non-clinical development and phase 1 clinical trials. In support of the first in human clinical trials with this liposomal methotrexate, a set of deeper studies were performed to complete the non-clinical package in arthritic mice. We determine the better drug-to-lipid ratio of this formulation and the dosage needed to obtain a therapeutic effect in arthritic mice. Results show that the most favorable drug-to-lipid ratio is 0.15, demonstrating a negligible weight loss and a better therapeutic effect compared with the other drug-to-lipid ratios. Concerning the dosage, arthritic mice were injected with several liposomal formulations at a methotrexate dose of 1, 2, and 4 milligrams per kilogram twice a week. Results showed that the 4 milligram per kilogram dose of target liposomes rapidly induced weight loss in the animals, leading us to switch during the experiment from twice for a once weekly injection. However, the dose of 4 milligrams per kilogram injected once a week did not prove to be as effective as 2 milligrams per kilogram twice a week. 1 milligram per kilogram twice a week had only a middle efficacy. Finally, the distribution pattern of liposomes was evaluated in arthritic mice by nuclear imaging through radioactive indium. Results showed accumulation of liposomes in inflamed joints within 30 minutes post-injection and were still present 72 hours after injection, which confirm a prolonged of targeting of inflamed joints. In order to evaluate the bone remodeling activity, radioactive methylene diphosphonate a radio tracer used in nuclear medicine for bone scans, was injected in arthritic mice with severe monolateral arthritis in the left side, in the left fore and hind paws. Radiolabeling reveals bone remodeling activity that correlates with accumulation of folate-targeted liposomes in joints. We can note that the non-arthritic joints show no or very limited activity in both methylene diphosphonates and liposomes distribution. Also, in support to the first-in-human clinical trial, we developed a novel method to obtain higher methotrexate encapsulation in liposomes. The lipid film hydration method and the ethanol injection method are the most common techniques to produce liposomes. However, these methods occasionally require the extrusion process to produce liposomes with a suitable size distribution and achieve low encapsulation efficiency of methotrexate, less than 5%. Indeed, due to the larger volume of aqueous phase in the outside environment of liposomes, compared with limited aqueous volume inside the liposomes, the encapsulation of methotrexate results in low efficiency. Based on the principles of the conventional ethanol injection method, we developed a novel strategy to increase encapsulation efficiency of methotrexate in liposomes and to obtain small values of size and polyspecificity index. The use of a reduced initial aqueous volume, 20% instead of the 100%, that is the pre-concentration, allied to the use of an organic aqueous ratio of 1:1 instead 1:5, proves to be essential to obtain a suitable size distribution without extrusion and higher drug encapsulation efficiency, almost 40% instead 5%. To sum up, we developed a targeted nano-encapsulated form of methotrexate that protects the drug from immediate dilution and degradation and is specific to the pathogenic cells. These characteristics leads to reduction of the dose and number of intakes, less adverse effects, enhance patient compliance, and a reduction of direct costs per patient. We have a unique knowledge through the intellectual property on targeting strategy, the folate peptide, and on the method for liposomal production with improved drug treatment. The non-clinical GLP studies to assess safety, pharmacology, and toxicology were conducted by the Contract Research Organization, UpToIt, located in Verona, Italy. In first instance, those range finding studies were carried out in rats and dog with a liposomal formulation produced by us with the developed pilot unit located at our research laboratory. Subsequently, major toxicological studies were carried out under GLP conditions with the objective to evaluate toxicity and toxicokinetics of the liposomal formulation in same two species. These liposomes were produced by the pharmaceutical company Blue Pharma in Coimbra, with the pilot unit developed by us following the GMP guidelines. Two phase 1 clinical trials will determine the tolerability and safety in humans and identify the doses to be studied in the next phase of the clinical study. This trial started in July, and at this moment we are evaluating the fourth and the last cohort without identification of significant adverse events until the moment. This trial is led by Blue Clinical, a private and independent clinical research organization devoted to the conduct and management of clinical trials in their facilities in the Hospital da Prelada in Porto. We hope to determine the efficacy of liposomal methotrexate formulation in patients with rheumatoid arthritis in the next year, we hope. One of the goals of Folate-targeted project was to ensure that R&D was translated in products through the creation of a startup. In this sense, Solfarcus was born as a spin-off of University of Minho, with the dream of becoming leading reference in peptide-based solutions for pharmaceutical and cosmetic application. In addition to the liposomal methotrexate, at this moment, Solfarcus is exploiting several technologies that were developed by Bioprocess and Bionanotechnology Research Group, from SED, and the patents were licensed for full commercial exploitation to Solfarcus. To finish my presentation, I would like to present you the partners involved in this work. Besides the Bioprocess and the Bionanotechnology Research Group from SED, headed by Professor Artur Cavaco Paulo, I have to refer the key contributions of the partners of the Folate-targeted European project. And it's all. Thank you for your attention.
Thank you very much, Eugénia. You must stop. Yes, thank you. Okay, thank you very much for your nice presentation. Now I am going straight to the questions, and straight. You have some questions here. Okay. Okay, I'm sorry. So, can you see it? The questions. Yes. I think the first question you have already answered, but perhaps you can add some details on this. But I think that in your last slide you have
yes.
Answered the question. Yes.
Yes, we are now in clinical phase 1. And yes, it's very difficult to achieve this goal because one thing very important is financial support, and this type of research is too expensive. So yes, it's very difficult, but it's possible. and you need to work hard to get financial support. Yeah.
Okay. Moving to the second question, what are the main competing solutions or players with similar solutions? Can you answer this one?
Yes, at this moment, there are not any liposomal or nanoparticle formulations for treat rheumatoid arthritis with methotrexate or other drug for rheumatoid arthritis therapy. So at this moment, you do not have a computer with us, but of course the next computer is the biological therapies, but they are very expensive relative to our solution. So we are in a good way.
Okay. And I think you have answered this one too, in part. What future developments do you foresee based on all the acquired knowledge and experience of the group? You have already listed some of the projects.
Yes. At this moment, you want to lead further the liposomal methotrexate. We are now in phase 1 clinical trials. We hope to be in the phase 2 clinical trials next year. But we can apply the knowledge of our group and the development of nanoparticles to other, including other drugs, and to target other diseases. Of course, the direct way could be the application in cancer cells, because our target agent, the folate peptide, can be applied in cancer because the cancer cells also express the folate receptor, the isoform alpha. So you can apply these liposomes, our formulation for treatment of cancer.
Okay. This is the fourth question. Nice presentation. Sorry, I may have missed this, but this is supposed to work in a prophylactic treatment?
No, at this moment, no.
Yes.
Our first experiment in arthritic mice was a prophylactic treatment, but in the patients, it's not for prophylactic treatment because methotrexate is applied after the recognition of the disease.
Okay. And how long will your clinical trials last? I think this means the second, that one that you are going to implement next year.
Yes.
Will it be long?
And we don't know, because as rheumatoid arthritis is a chronic disease, we have to implement a long study with our liposomal formulation. So you need to do other developments and other studies to apply this liposomal formulation for the next clinical trials.
Okay, thank you very much. I think that we have reached our limit time, just in time. So thank you, Eugénia, and thank you everybody for the attention to this nice presentation. We will be back next Thursday with the PhD edition. Thank you.
Okay, thank you. Have a nice day.